Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning into the Tate Chronicles. Join me to cut through the fog that exists at the leading edge of healthcare technology. Our mission, searching for beneficial disruption in healthcare from emerging technologies. My guest today is Dr. Gordon Jones. He's the co-founder, president, and COO of Universal Health Coin. Dr. Jones, welcome to the Tate Chronicles.
Thank you. I appreciate it. I look forward to having a conversation with you.
Absolutely, and thanks for being willing to share your knowledge and your experience. It's a whole new area, blockchain, healthcare. You've been involved with healthcare a long time. You've been on the technology side of things for quite some time. And so let me just kind of ask you this question as a generality. What was the path that led you to founding the Universal Health Coin, and what does it bring to the table, this Universal Health Coin? What was it behind the initiation of it, and what are you hoping to disrupt with it?
Well, you just jumped right into it.
Yeah,
I'll tell you, my whole experience has kind of led up to the Universal Health Coin, because I was pretty much semi-retired when a friend of mine, not a relative, but a friend who just happens to have the same last name, Courtney Jones. He's a co-founder of a company called FindWhat.com back in the 90s. That was the search engine that invented pay-per-click. And he's been in cryptocurrency since 2013 and blockchain. And we met about a year ago, and he asked me, hey, Gordon, if you were going to do a project in blockchain, what would you do? And I wasn't an expert, actually still not an expert, but I'm pretty well versed on it now. So I had to tell him how to think about it for a little bit, and I did my research. And at the end of the day, it all comes from my last 25 years of experience both on the health services side and on the healthcare technology side, and in particular health tech startups. But at the end of the day, the only way you're going to change healthcare is by being the payer, because only the payer, whether it's the government, the insurance company, the self-insured employer, or the family itself, only the payer can create the incentives that will enable individuals and doctors and the health system as a whole to change their behavior, as well as incentives to adopt new technologies and business models.
Mm-hmm.
And so when I got back with Courtney, I said, listen, Courtney, there's a whole bunch of initiatives around building electronic medical records on blockchain, and doing health information exchanges on the blockchain, and trying to put the claims process on the blockchain. And all those things are good and noble, and they may create efficiencies, but the problem is that they're just putting Band-Aids on what the problem is. And the problem is the old way of doing business in healthcare around payment and funding. And so I got back with Courtney. I said, so what we need to do is we need to become a payer, and we don't need to become a traditional payer. We need to become a new kind of payer.
Mm-hmm.
So that's kind of what kicked off the idea behind what we're doing with the Universal Health Coin, and reinventing healthcare finance and payment utilizing blockchain and cryptocurrency.
Well, now, one thing you mentioned the word incentives. So are you talking about something in addition to just traditional reimbursement for procedure or for encounter, that one of the big phrases now is pay for value? And so is this that type of incentive you're talking about, where there's a pay for a certain kind of value?
Yep, so you can say that, but that's across the board. So it's not just with the providers. And I tell this story. So, about a year ago, the VP of technology for the Bank of Ireland was sitting around with the C-suite talking about blockchain and how they're going to be able to compete in this arena. And he basically told the board, he said, listen, this is all new, and we don't have just the opportunity to adopt blockchain as a way of creating efficiencies in the banking system, but we have the opportunity to create new banking business models. And so that's what we're doing at Universal Health Corp. We're creating a new healthcare business model. And so the incentives are certainly according to helping providers be incentivized to provide quality of care, but it's also an incentive model for members to live healthy lifestyles. And if they are sick, to be incentivized for complying with their doctor's orders and getting well faster, because that lowers the cost on the ecosystem. And so we are creating the incentives to enable the providers, the members, patients, and even the supply chain to be more efficient. And that's not just through payments, but it's also through utilizing the token system to create rewards for good behavior.
And so let's just film an example. So it's kind of interesting talking about incentivizing patients. So if a patient has a high BMI and is able to bring that or start working, bring that body mass index down to a better level, they would receive some tokens?
Yep. So first of all, you brought up something very near and dear to my heart, the BMI, because the other thing that we're going to be doing is utilizing IBM Watson AI inside our ecosystem. And I was in the Army when I first had my first BMI check. And every single time I was told that I was overweight. And the problem was I only had 11% body fat. And because of my athleticism and build, every time they did the basic BMI, they said you're fat or you're overweight, and then they had to do the pinch test. So I really don't like BMI as an analysis. But anyway, I'll go with that.
Sure.
So let's say there is somebody who becomes a member, and they are overweight, maybe a couple 100 pounds, and they're diabetic. And they understand our business model, and they say, okay, well, I think that I would like to use your platform to also help me become healthy, and because of the incentives, I'll actually get rewarded for that. So they'll go to their doctor, and their doctor will get paid for providing the services, but as a result of that visit, then the doctor will come up with a plan for them to reduce their weight and work towards becoming pre-diabetic again. And when they will agree to that order, and then the system will help them comply with that along with the community. So we're a community of members who are funding each other's care. And so it's not like you're going to the doctor's office and United Healthcare or your employer is going to be paying the bill. You, your family, and all of your friends that are members of this community are going to be paying your bills. So this is another layer of the incentives, is actually putting personal responsibility back into the puzzle.
Sure. Because
now you know your community is actually, and you know who your community is. I mean, you might not necessarily know the person, but you know that there's a live family out there who's committed to covering the cost of your care because they're looking forward to you one day, if the need be, to help cover the cost of their care. And so, so really, at the end of the day, what we're doing is we're adopting what in the United States is called the health cost sharing organization model.
Sure.
And there are there's 104 of these plans out there. The three largest actually have over 1 million members in them, and the largest one I believe is MediShare, that you may know and have heard on the radio.
Sure.
MediShare, which is a health cost sharing ministry. Now they're all mostly faith-based. They are grandfathered into the the Affordable Care Act. And it wasn't ever Affordable Care Act, but it was the Accountable Care Act. But But anyway, so they're grandfathered in. So we love that model because they're not insurance. So they don't pull the money and then and then become some disinterested entity that's paying the bill. Their community knows that they are covering the cost of each other's care, and so we're taking that model. It's not faith-based because we're going to be worldwide. So we already have 23 countries that are interested in adopting our model, and those faiths go from Hinduism to Muslim to Christianity and everything in between. And so we're not a faith-based model. We're a community-based model, but the community could be worldwide. I mean, we could have members from Brazil, South Africa, and Canada sharing each other's costs throughout the year.
Sure. Is it necessary for the provider to be part of this, community or network?
So we're not necessarily building a network like you traditionally think in the United States. You have to have a PPO or preferred provider or a in-network, because we won't be categorizing the care that way.
Correct.
We expect that providers will come on board as they hear about it because we're paying cash. And so we're negotiating cash-based pricing, and our system gets rid of the middleman, gets rid of the claims processing piece of the puzzle, which also reduces the administrative costs. And this is one way we're able to lower the cost of care for our members. But we're not requiring the physician's practice or the health system to submit a claim to us and then wait for 2 weeks to 120 days for payment.
Sure.
Once the service is provided, we actually pay the provider at the time of care, and it's in cash. And since we're worldwide, it'll be based on their local currency. So here in the United States, it'll be U.S. dollar. But if a member goes to a hospital in Mexico, then it'll be pesos. And if they go to somewhere in the EU, then it'll be the euro, and on and on. So what we're doing is we're building a system that enables providers to come in and create transparent pricing that is competitive with their peers based upon quality and location. And so they will eventually start providing us very competitive pricing because they're competing with each other in a local market, but they're also able to reduce their cost of administration, which lowers their requirement it enables them to be able to be very competitive in their pricing with us. And then the fact that they know that we're paying them instantaneously really motivates them to become a part of the community. Now, they don't have to be paying members as if they're getting their benefits covered. Sure. However, it's a great way for them to provide benefit to their employees that is much lower cost. So we're really excited about it, and we've gotten a lot of great feedback from providers throughout the countries that we're already talking to.
And so when you say they're paid instantly, are you built on Ethereum and you're using smart contracts, so as soon as the service is provided, payment is released to a provider?
Yes, we are not building on Ethereum, so we did look at Ethereum early last year, but their transaction speed and cost was a little unreasonable for us for a healthcare solution. We then looked at several other platforms, and actually I write about it in our blog. But we have chosen, first of all, we partnered with IBM, so we're building in the IBM cloud. IBM does have a blockchain platform called Hyperledger Fabric that they really promote and use, but we haven't chosen that either because that's more for permissioned and centralized-based blockchain projects. So we partner with Stellar, and Stellar is an international payment platform that allows for rapid and very low-cost exchange from fiat to fiat. So if a member pays in the U.S. dollars here in the U.S., and then they go to Europe for some care, and then the payment is out in euros, then the Stellar network allows us to make that happen very quickly in about .0009 cents per transaction, so very low. And then so we'll be building our own smart contracts within the Stellar ecosystem.
Tell me a little bit about the Universal Health Coin's trajectory, where you are in the issuance of tokens. When do you expect to go live, or are you live? How's the rollout looking? What kind of timeline are we talking about?
So Courtney and I just met a year ago, and we came up with the idea probably in July, and we started doing all of our research and writing the white paper, and we published the white paper in October of last year. We incorporated as a public benefit corporation based out of Delaware. And the good thing about a public benefit corporation is the emphasis is on benefiting the customer and not the shareholder. We really liked that model and adopted that to be our corporate entity here in the U.S., though we are incorporated in Canada and looking at overseas locations as well. But so we published the white paper in October. We were planning our token sale in December, but because of the regulatory questions that were coming down out of the SEC here in the U.S. and around the world, we put that on pause for a little while, but we were also entering our relationship with IBM and some other technology partners. So we wanted to be very diligent in this. We're not just trying to do an ICO to raise $1 billion. We're wanting to create a real company with a real service that helps people around the world, and so we've been very diligent in that. So, but our plan now, so we have our what we call our MVP, or minimal viable product, is in development. We've contracted with the Mohawk University Medic Labs out of Hamilton, Ontario. They develop all the mHealth and eHealth platforms for the Ministry of Health for Canada. So they've got 50 developers, so they're not students. They're actually employed developers that are working diligently on healthcare projects around the world. They do some projects with the UN as well. And so we've hired them as our developers initially, and they are busy building our blockchain platform with Stellar. But we've also contracted with 3 providers that are going to be able to allow us to offer services immediately this summer. One is a company out of Austin, Texas called Karis, K-A-R-I-S. They're basically a health advocacy service. What they do is they contract with the employers, self-insured employers, a lot of these health cost sharing ministries, and provide the health advocacy and logistical help for members of these plans. And so we've contracted with them, and they'll be able to start right away this summer in helping anybody who's a subscriber to the Universal Health Coin system. We've also contracted with Teladoc, so we're integrating Teladoc into our platform, and as soon as that is completed, we'll be able to allow our members to have online telehealth visits with Teladoc's 3,100 doctors around the U.S. And then Teladoc also owns Best Doctors. And Best Doctors is a network of physicians and other healthcare providers around the world, about 53,000 of them thus far. And they're around the world, and they act basically as a second opinion network. So if we have anybody around the world who's gone to their doctor and gotten a diagnosis that they may have some more questions about, then we can, our concierge service will link them up with a specialist through the Best Doctor Network to render a second opinion on that first treatment option. And so these are the things that we're going to be rolling out this summer, while we build the community cost sharing application on the community cost sharing application on the blockchain solution that we're building. And that should happen. We'll probably be in beta by the end of the year with the community cost sharing program, with a full launch to the decentralized system worldwide in the first quarter of 2019 for that.
It seems like every day or every other day there is a blockchain summit or conference someplace. It's amazing how many conferences are springing up. And there are a lot of them that are springing up that are healthcare related, specifically healthcare related and blockchain. Have you attended any of those? Do you plan to go into any of those? Have you, seen much about those?
Yes. Well, I've been speaking about 3 times a month for the past 3 months at blockchain and healthcare blockchain events. As a matter of fact, I will be speaking at the Healthcare Blockchain Conference in Boston on Monday.
I'll be there. I'll come shake your hand. I'm going to be there. Yeah.
Okay, good. Yeah. So I'm speaking on a panel, so I don't have a 20-minute speech or anything like that. I'll just be sitting in on one of the panels in the afternoon. But yeah, I look forward to seeing you there. We'll plan on that. If anybody of your listeners is going to be in Boston on Monday or Tuesday and wish to sync up, they should come over to the summit. I don't have it off the top of my head of where it's located, but I'm sure you can find that out and share it.
Yeah, it's the Healthcare Blockchain Summit in Boston, June 11th and 12th. So, that kind of brings me to another question. How would if somebody wants to find out more about what you're doing, how would they get in touch with you or the company? What's the best way to reach you?
Well, the quickest way is to go to the website, which is universalhealthcoin.com. And on there is all of our information, including our white paper, which we call our blue paper because we have it in blue background, so we call it the blue paper. But all the information is there. We're planning our token sale for July the 2nd, and we're actually in a private pre-sale right now. So we're talking to angels, strategic partners, some venture capitalists to participate in our token sale right now. So we call that our private pre-sale for accredited investors. But in July, probably not in the U.S., but outside of the U.S., individuals who may or may not be accredited level will be able to participate in our token sale. Okay. And they can find all that information out on our website.
Okay, great. We've only got about 4 more minutes, so let me bring up some high-level things I'm always interested in getting responses to. So we are very early, just not necessarily in healthcare specific, but just in blockchain. We're very early in the disruption of blockchain. And so, the trajectory, it's kind of funny when you talk to me about blockchain, there seems to be a need, people want to understand it. Now, nobody understands how email works, and we don't care. And so at some point, it's just going to be in the background, driving disruption and efficiency. Go ahead. So I like
I was just going to say, so I was going to say real quick, it's a tool, just like the Internet is and everything else. So when we start marketing our services, we won't even be talking about blockchain and cryptocurrency. We'll be talking about community cost sharing, immunization programs, telehealth, health advocacy. We'll be talking about the services that benefit members and providers, not blockchain and cryptocurrency, the technology.
Well, I can't believe it, but our time is already gone. So we got to draw it to an end here. And to the audience, I want to send a thanks for joining me on this episode of the Tate Chronicles. You can find more information on this show's program page at healthcareradio.com. healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.